I always wanted to do pediatrics. There was never a plan B. I'm originally from Lima, Peru. I looked at IU as one of the top residency programs in the country. I immediately felt that I belonged in this place. The way people treated me, the way people saw the identities that I brought with me, and they saw that as a valuable asset to the residency program. I can say I can make a difference in people's lives every time I come to this place.
I think our program is really unique and really fantastic in the amount of depth and breadth of pediatric training that you're going to get, and then also how we individualize the training for our residents. We have clinical tracks and scholarly tracks. We're able to allow for every single resident to get the same baseline core education, but then really be able to tailor all of their individualized curriculum for what kind of career they want after they're done with residency. So we can tailor their education in residency to help them be successful for that next stage of their career. Our clinical training is second to none of anywhere else that we get in the country. Because Riley is the #1 children's hospital in the state of Indiana, our pediatric residents are really going to get to see and do everything while they're here in their residency trainings. And we have our residents rotate through every subspecialty within pediatrics.
I mean, we get to rotate through nephrology, GI, cards, hemonc, all like the big ones that you really need to get those kind of experiences. We see a huge variety of patients and diagnoses.
I love the patients we take care of. That's why I went into it. I went into this for wanting to help kids. We want our program to look like the patients we serve or the population we serve, which is very diverse here in Indianapolis and across the state. Being a doctor is a position of privilege, having a responsibility to the communities we live in and the communities we serve in and the patients we take care of. And we should advocate for our community, engage with our communities that we live and work in, and help to make things better for all.
Anybody can learn medicine from every possible source. One of the things that I focus on is how to provide compassionate care. As part of our education, we always need to learn that not every patient comes with the same backgrounds, the same experiences, the same trust in the medical system. When we see that there are discrepancies on the outcomes that our patients face, when we see that there are communities that are hurting, it is our responsibility to stand up and to make sure that those inequities are addressed, because that's something that we promised to do.
I love the fact that residents are right at the prime of their career. They're so full of excitement and they want to do a lot of things. They want to see a lot of things. And then to see that growth to when they're a third year and they're very confident and they're teaching others about their skills, the amount of growth that you see in 3 years is exponential.
They let you be more free in terms of really taking ownership of the patients and coming up with your own plans.
From the get-go, everybody wants to make sure that you're getting better, that you're learning. Coming from a different country, different language, different culture, getting here, you're gonna feel like home.
It's a very personality-centered program. I've enjoyed everybody I've met here.
They have literally every fellowship that I'm interested in. They have a large network of awesome and brilliant physicians.
I love that there's a primary care track here. It gives you a lot of options in trying to personalize your experience, which I really like. And we get a lot of opportunities to explore.
I'm excited to learn a lot from some really intelligent people who have been doing this for a lot longer than I have.
It is very easy to get into research. It's a big academic institution here.
So the Well Center is one of our big research centers here on campus. We are one of the leading programs in the country for pediatric research. So residents who are involved with research projects have the opportunity to work with physicians and physician scientists and other PhD researchers in that area to help them do pediatric research. I actually think Indianapolis is a little bit of a hidden gem. It's a big city that doesn't feel so big. It's a very affordable place to live. Many of our residents rent apartments or homes within the downtown area and live very comfortably.
There's always something to do. There's sports, which I enjoy watching.
You have the NFL team, you got an NBA team, you got a minor league baseball team, hockey.
It's very walkable. There's a lot to do downtown. And
Walk to a brewery or walk to a bookstore or get coffee.
There's so many new restaurants that I've been trying out.
I really think like Mass Ave area is awesome.
I've loved it so far.
Number one, I want a resident who is enthusiastic and excited and wants to be here. I want a resident who's not afraid to go above and beyond for their patients, to have residents who really think outside the box, who are team players, who are dedicated to one another, dedicated to their patients, intellectually curious. We can teach you the medicine, we can't teach all of those other things. That's what we look for in our interview process.
Having been a resident here and a chief resident here, IU School of Medicine and Pediatrics provided me with the best possible training that I could have expected. If I have to choose to do it all over again, I would choose IU. No questions asked.